It's very smart. Let's talk about DNA. We were just talking about our DNA, our evolution, how we evolved as humans. So let's talk about this DNA thing. Why do we test for DNA?
Ah,
Why do we love DNA testing?
I love DNA testing because you do it once in a lifetime and you can design your life around it. Like literally, people don't know what they don't know. Once you know how your body works based on the nutrigenetic testing, then you can modify your environment to fit you like a glove. Before, you didn't know why your vitamin D level was low all the time. Now you know because you're not activating and you're not transporting to the to the cells that vitamin D. You didn't know why you didn't feel good after, maybe going to a party and eating or drinking the wrong things. Now you know because you don't have certain liver enzyme and so forth and so on. You know exactly how your body works and you can change your environment. You can avoid, the extra toxins. You can have the proper cofactors. You can avoid the substances that actually interfere even more with the function of those genes that are impaired, the function of the enzymes that are impaired. So you're not putting gas on fire. Like green tea is not good for everybody. Onions are not good for everybody. Some people need a lot of selenium or a lot of magnesium. And it's an eye opener. And when you're spreading that to like sports, to know exactly what type of sport is best for you, to how to avoid injuries. Are you at risk for, uh, tendon structures? Do you need, faster, smaller weights, repetitions, or you need like heavier and slower, and so forth and so on? You know exactly why you know, you're having a sweet tooth or you don't feel satiated at the end of a normal so-called meal. Find out what's best for your skin. You find out, why you've had problems dealing with stress or remember all that trauma from the past and you cannot let go, or you have more addictive personality. I mean, it's enormous and amazing the information that you can get from this. And I try to explain to everybody that all their children should have this because you can literally help them design their life. And when they're little, you can influence their behavior. They can understand now why they have to do certain things. It's not because I say so, but it's because of your genes. And then they are free to, do what they're supposed to do, but they know at least what options they have. It's, I think, the next best gift to life that we can
I
give them.
absolutely agree. I absolutely agree. Like you said, you do it once and it's a
Yeah.
roadmap for life. You don't have
Mm-hmm.
to do it all the time. And now it's telling you it's a GPS system. You know how to navigate this vehicle throughout this confusing life because they will have so much information bombarding us. Take
Mm-hmm.
this vitamin, eat this food, don't eat this food, do this, don't do that. What is it good for you? Is it good for you according to your genetics, or is it just something that it's not for you? Like you said, some people need a lot of selenium, some people don't. Yeah,
Yeah.
I absolutely agree with that. And the very important thing also when you go, you check your vitamin levels, for example, vitamin B12 level, your levels are great, and you still have symptoms of metabolic disease, metabolic syndrome, and your doctor says you feel fine. But what happens? That B12 is circulating in your body, but not going into the cell. So the cell is still starving. Levels looking great, but that vehicle that takes that vitamin and brings it inside of the cell that governed by MTHF and MTHFR and all these genes, it's mutated. Yes, you have high levels, but you don't have high levels of vitamin, but you don't have high levels of energy. You're not feeding your body. Or, for example, cholesterol. Like
Mm-hmm.
you go, your cholesterol is elevated. Doctor puts you on statins. Why? Because you have very high risk of cardiovascular disease. Why? Your grandfather died from cardiovascular accident. Your father died from cardiovascular accident. And now you have elevated cholesterol. You can die from that as well. But according to your genetics, that cardiovascular accident can happen from 3 reasons. Reason number 1, it could be inflammation of endothelium of the blood vessels, of the wall. Has nothing to do with cholesterol. Number 2, it could be clotting problems genetically. You just create clots and you die from it at a young age. And number 3, cholesterol plaques. Don't you want to know what your grandfather died from? Yes, he died from a heart attack, but what was the reason? And based on that, you will make a decision. The doctor will tell you have to be on statins, but you're going to sit down, you look at the whole picture, and then you take a step, you take action. Of course, you can talk to your doctor. You're not going to do it by yourself, but at least it's going to be conscious decision in your health, in supporting your youth, supporting your longevity. So simple things or not so simple things like that, it gives you so much information and so much freedom to navigate in life when you do that genetic testing. And it's so easy. All you do is just swab, put it in the box, and send it out.
Or
And then
5
you get
drops of
this,
blood.
oh,
Or
blood,
5 drops
yes,
of blood, right? Yeah.
exactly. And
Yeah.
then you get this report, and you sit down with your clinician, doctor, whoever it is, and they give you the whole map and you take it. Another cool stuff that it's always evolving. So then you're going to get more information. If you have one information about that particular gene and you're working on it, we're evolving, we're getting more knowledge. Then you get more information, but the structure is the same. Genetic is the same.
Yeah.
So it's
Yeah.
such a great, great tool for doctors. I love it. It gives me so much information and makes my life so much easier to manage my patients. And I'm sure you have the
Absolutely.
same. Yeah.
Absolutely. And accurate. And people do have aha moments. It's very, very interesting. And with mood, right? With mood disorders, you can find out exactly what's happening with certain, like 1, 2, 3 enzymes, and you figured out how to fix the depression without a medication or SSRI or anything. Not to be on medication for life when you can just look at your genetics. Yeah, the amount of information is amazing, and I don't understand why it's not used in traditional medicine, but oh well. We all learn genetics in medical school, right?
I know it's a whole science. It's a whole section there. Yes, but it will happen one day. I think we're evolving as
Yeah.
well as a medicine, as as a medical industry. We are evolving.
Mm.
Just the
Oh,
fact that we started talking as a mainstream, medical facilities start talking about adding vitamins to certain protocols. It's a big deal. It's a big deal. So
yeah.
I
And
think
the
we're moving.
gut-brain axis was a big article in an internal medicine, journal. Okay, we're waking up here. Okay, good,
We're
good.
waking up. Yes,
Yeah.
it's good. So the life is evolving. The future is bright. And I think it's good to be on a leading edge, understanding what is happening and bringing that education, that knowledge to our patients. I think it's honor for us to be in that position right now. I'm very honored and privileged, I think, to serve my patients.
Absolutely. I mean, I feel empowered, and I'm so happy that I was open to it, because definitely I can serve now patients that I could not serve before, and they have amazing results, and they are not upset at me anymore for switching from traditional medicine to functional medicine, because now they understand why when they see their own results. And it's amazing to transform lives. It's impact. I think we all have certain core values, right? And one of my 3 core values is impact. So, and healthy impact, and helping people have a healthier, happier life is the best thing that you can, the greatest satisfaction, I guess. It's an
It was a
amazing
pleasure
feeling.
talking to you. It was a pleasure talking to you. It's amazing to talk to
Likewise.
another MD and understanding that we all on the same path and we on the same page. It is very, very reassuring and empowering, like you said. Thank you so much. And I'm sure we're going to do more of those meetups and bring more knowledge and share with our patients.
Absolutely. Thank you so much for having me. Look forward to the next one, and we'll talk soon.
Thank you.
Thank you.
Bye-bye.